Hi, folks. So this week, basically, we will be looking at Chapter 1, Introduction to Healthcare Information. So obviously, this course is all about healthcare information systems. Over the course of this semester, you will learn about different technologies, but this is Chapter 1. So, I mean, there's there's for you to understand certain things that, patient information could be related to its all the clinical information, meaning about, patient's weight, height, blood pressure, A1C1 level. It could be related to administrative issues such as patient, what sort of insurance does the patient hold, what sort of claims has the patient filed. And then you could have a combination, and then HIPAA is one of the most important rules or terms that you will be learning in this course. HIPAA is basically the law that protects patient information, and we'll talk about HIPAA later. But essentially, what one needs to understand, you need to understand that when you read the chapter 1 from the textbook that is prescribed, you will understand that HIPAA basically allows a patient to protects the patient's confidential information, and if there are HIPAA violations by the care provider, by the payer, by the pharmacy, by the doctor, what have you, then there are implications for that entity. Then especially HIPAA comes into action where we have a lot of information, patient data floating around, digital information, whether it's an EMR, or electronic health record systems that you may have read about or you will read about, or EMR, electronic medical records. Um, then we talk about internal data, external data. Now, one of the things that you will notice in these videos is I won't be explaining every content or every term um, in the videos, but I will just sort of talk about the highlights of the chapters, and that will allow you to understand what's important, what's really important versus what's important and what's not so important. Then patient encounter data, something can be like we've said, clinical data, administrative data. Patient records, of course, as you can see. What about patient records pertaining to patient care? How do you communicate with the patient? Legal documentation, the billing and reimbursement issues related with the patient care. Then these are the basic contents of patient records, the electronic medical records that I was talking about, identification from what is the medical history of the patient, medication record, what is the progress, what type of consultation did the patient have, what happened, what was the outcome of the consultation, etc., etc. Then it also includes lab reports, X-ray reports, all that, pathology reports. And this is an example screenshots of typical electronic health record, or EHR, records that a care provider such as a physician or nurse has to put in after a patient visit. Then again, these are just walk you through the screenshots. And these are codes, right? So every time you walk into a clinic or a hospital and you get treatment and you have reimbursement, so the provider has to file a claim with the payer, which is Aetna or United Healthcare, whatever insurance company that you have insurance through. But it doesn't, like, so let's say you have come in for a regular checkup. You just have a headache, and you come in for a regular checkup with the physician. That code is different from probably a checkup that you have come for, maybe a problem, or a knee problem. So these are codes that the provider provides to the insurance companies, and the insurance companies basically reimburse them based on the code. So every type of interaction if it's different, it has a different code, a unique code, what have you, kind of like a unique number associated with the type of consultation, type of disease that you've come in to consult with. Uniform hospital discharge data elements, you just want to read through this. Coding systems, right now we're in ICD-10, So this is kind of, oh, we're looking at ICD-10. Please focus on that. Understand what the concept of ICD-10 is. I mean, you don't have to memorize the codes or anything, what have you. Then, like I said, coding standards. This is if you read the chapter, you'll understand what the screenshot is about. It's about the sample diabetes query. If a person comes up or patient comes with a diabetes related issue. So these are the things that are important. CMS Center for Medicare and Medicaid, one of the largest, is the federal body that governs Medicare and Medicaid. Okay. Then next chapter is on chapter 2. Sorry, chapter 4, but it's this same week. We're talking the same week. It talks about the history and evolution of healthcare information systems. So it's more of a historical perspective, how things have evolved in the United States as far as healthcare is concerned. Start back in the 60s. Certain definitions you should know: data, processes, people, technology. Then you have administrative information systems versus clinical information systems. Just know the difference between those two. Then we talk about, patient administration systems, financial management systems, history of healthcare information systems in the United States as it pertains to the United States, how it evolved, where we were in mainframes, and then now it's kind of like the 80s, 90s, where healthcare information technology became really important. Institute of Management, or IOM, calls for adoption of computer-based patient record. That's where the revolution or the evolution of all these electronic health record systems started, or the whole idea of technology being an enabler in healthcare became a really, really pervasive philosophy, thought process. In the 2000s, healthcare, it's focused on health IT, and basically, what are the things that evolved? Okay, another thing I just wanted to point out to you was that every week you will be also assigned with few readings related to the chapter itself. So when we just, for example, it's a 2014 publication, Health Information Technologies, Fallacies and Sober Realities, and we'll talk about, it talks about what is the good and the bad aspect of health information technology. I mean, everything is not good, everything is not bad. There's a mix. It depends on how one utilizes it, depends on the stakeholder, how they utilize it. Then the next reading would be Role of Healthcare Information Technology in Information Systems. It's again a fairly recent 2011 article, so you might just want to read over it. Then the next article is U.S. Healthcare Industry. This is more like a report. It's Mackenzie Report. Mackenzie is one of the most reputed management consulting firms in the world, based in the United States. U.S. health companies, just a report on how U.S. companies can thrive using technology in healthcare. Okay, and then the fourth reading is Promises of HIT. Is again a fairly recent article published in 2013 about what it'll take to achieve unfulfilled promises of healthcare information technology. So this is kind of like the gist of this week, where you have chapter 1 and chapter 4 one talks about the basics of healthcare information systems, and then the other talks about history, and then you have these 3 or 4 articles that talks about, what are the pros and cons of healthcare information technology and where we are going with healthcare information technology. So as far as this video is concerned, this is for this week related to chapter and weekly readings. This is the video.